All right, good morning, everyone. We in a beautiful Griffin Park, Los Angeles, California, and we of course continue our rehab exercise. A lot of people complain on the hip. They explain that stiff and jammed hip, one hip particular. So what's happened with us most of the time, we most shifting weights to one leg. If I'm shifting all weights in one leg, what happened to me, I put too much pressure and that bone, my femoral bone, go inside that socket and lift that hip up, so it started do this rotation. I will show you one great exercise, how to, not the exercise, it's kind of rehab therapy, how to release that tight hip. And we have a whole bunch of bands. I'm a heavy guy, so I prefer to do the really big heavy band. This is like a 50 pounds band. I have all different type of bands. We're gonna do a lot of cool stuff today. So I found something really strong, so it's nothing pullable. I make sure it's nothing like any sharp object, any like piece of metal. So I don't want to, if band is not gonna hold me, I don't want to flip on the floor and do some damage. So what I'm doing here, I found that area, the level of my hip. So attach that band, and how I do it, I go around that pole, and another tip is go inside, and that's it. So this is how you adjust it. You recheck if any tear, I can see that's right in here, but who cares? So next one, what I'm doing here, gently pull my leg inside that hip. So I do one leg first. And what I'm doing, I found that bikini line. Guys, be careful, do not jam anything. So what are you doing here? You find that bikini line and you're gonna step away as far as possible. So you see the band is gonna resist me. So what's happened here, when I push my weights forward, that bone is kind of start shifting out. And this is what I'm doing. So bikini line, and I'm doing here, just kind of lean forward. I'm just hanging out up here and raise myself up. I can do kind of like banding exercise, shift my weights back. You're working on that hip flexor, so I can just hang it out up here. I can do more stretch, pull more, and it feel amazing. So also I do sides position too. I kind of lean this way. So I distracted all different directions. So it's pulling this way. Now forward too, why not? I stay up here, do some bending exercise. Here we go. Look, and I found that motion is actually kind of weak for me. Here we go. So 3 ways. This way, forward. The forward is the most powerful one, and lean. Distract. If you want a more action, sometimes people do half kneeling. This is really powerful. If you have any pad or you do it at home by the door, it's also a good idea. So all you need to do, if this is the leg applying bands, this is band have to be half kneeled. So this one is in the front, and this is what you're doing. Just step back. You might lower a little bit, band down. I didn't do that. And what are you doing here? You kind of stretch. Let me show you towards you. So this is how it look like. You see the band is trying to distract me, pull me this way, and I'm just doing this nice pulling sensation. You feel this in your hip flexors, you feel this in your quads. So use this exercise. It's really great exercise. And of course, like I said, you can do all different type of bands.